everyone for joining us here as we wrap up the day. I am Rosemary Plurine. I am CEO of Lovell Communications. We're a healthcare communications and public relations firm here in Nashville. We've been around for 35 years. And earlier this year, we became part of the Health Management Associates organization. I'm very, very pleased and proud of that. And I am delighted to welcome a few thought leaders and smart cookies to the stage. I will let you all introduce yourself. We'll dive in on a couple of questions, and to kick things off and give folks a little bit of flavor for who you are, when you introduce yourself, let us know what you do today, your day job today, and tell us what your first job was, the first way you made money, whether it involved like taxes and a paycheck officially, or but yes, if you would.
Can you hear me?
Yes.
Okay, great. Wonderful. Well, thank you so much to State of Reform, and thanks, Rosemary. I'm delighted to be here. I'm Apryl Childs-Potter. I currently serve as the president of the Nashville Health Care Council. I'll share a little bit about what that organization is and why it's important here in Nashville. About 30 years ago, a group of visionary leaders in this city who also happen to be CEOs of some of the earliest for-profit healthcare companies came together and said, we want Nashville to be a capital of healthcare. And to do that, they decided they needed to come together, even though in some cases they were competitors, and talk frequently about the challenges of the industry and what they could do as healthcare leaders to make Nashville the most attractive place in the country for healthcare companies, talent, and investment to thrive. So fast forward almost 30 years, there are 900 healthcare companies that sit in Middle Tennessee with either operations or a headquarters, and that represents about 500 direct healthcare companies and 400 service provider companies like Rosemary's who specialize in supporting this massive industry. For perspective, you probably know Nashville as the music city. That music industry, though very important to us, contributes about $10 billion annually to Tennessee's economy. Healthcare contributes $68 billion. So we like to say you're actually sitting in the healthcare city.
Indeed.
So that's what I do today. My actual first job, and I'm not certain about the tax purposes side of this now that I'm thinking about it. I was probably 15 and I was commissioned over the summer to babysit two neighbor children who were newly minted tweens. And so my job was to take them back and forth to all of their summer activities. This engagement of employment was supposed to last for, I believe, 6 to 8 weeks. 10 days into this arrangement, these children were so ill-behaved that their parents relieved me of my duties, but went ahead and paid me for the rest of that first month and found an adult professional caregiver. I'm happy to report these women have grown up to be wonderful members of society. I am just not a great, I'm not a great nanny. So
I think that was hush money.
maybe so.
Very, very good. Thank you. Natalie.
Awesome. Good afternoon. Let's see. Can you hear me okay? Hi, so I am Natalie Cooper. I am the president and CEO of Amerigroup Tennessee. So we are one of your managed care organizations providing Medicaid in the state of Tennessee. We serve about 520,000 members throughout the state, and really excited to be here. When we think about how we make a difference, we really are focused on some of our most vulnerable populations throughout the state. So today has been a great day to partner with you guys to learn more so we can all lean in and really make a difference for the Tennesseans. And when I think about my first job, so I was like the little girl in the mall at those little carts in the middle. And back in the day where you can make people's names on the bracelets and then you can print off their name on a little piece of paper. I see people, yep, that was me. You'd be ready in 3 minutes and you buy, 2 for $12. So that was my first job and something I love. So, yeah.
You've definitely got skills that we haven't tapped into yet, so we'll remember
100%.
That. Yeah. All right, well, we'll dive in. Healthcare is ever changing. We all know that. We accept that. I think it's what keeps me in the industry. Honestly, it keeps things interesting. So change is the norm, but the unwinding of the continuous enrollment provision is pretty seismic. We had lots of discussion about it earlier today. Some of it fairly nuts and bolts. But I'm interested in your thoughts, sort of on a higher level, from a different perspective, even from an industry perspective, on the broader shifts that you're seeing, your members are seeing, your clients, your partners are seeing, positive or negative, following this particular seismic change relative to redetermination.
Sure, thank you. So when we think about redeterminations, there is really a larger focus on social determinants of health. So for redeterminations, that's the actual renewal period for any and everyone in Medicaid. And for a lot of our members, they are newer to Medicaid. They came on during the public health emergency, so they're not used to this re-verification period. So a lot of it is a gap, ensuring that we're educating along the way, but also really understanding that through the pandemic, there were a lot of things that really came to light, and understanding the true social determinants of health that really impact the health and well-being of someone in our community. So if you don't have a stable house, or you don't have food or a place to work, you're really not focused on your health care. So ensuring that we are really partnering with organizations who can really help us to deliver that. Something that we're doing in Amerigroup is we're really working to identify the anchors in communities. So an anchor is a trusted organization in the community, because as a payer and insurer, we can have a number of benefits, but if our members don't trust or don't know who we are, they won't take advantage of that. So we really pride ourselves on partnering with the anchors throughout the communities, throughout the entire state, to ensure that we're working with trusted partners to deliver for our members, and also ensuring that we understand those social determinants of health that are impacting the overall health and wellness of our members in the community.
Much like figuring out how to work our microphones, this is a very complicated issue, right? And so I represent about 330 organizations here in Nashville, but they operate across all 50 states. And so I can talk a little bit about what I hear from the executives in our healthcare companies around this issue. And I would say some of the silver linings, maybe, if we could call them that. Obviously, this is an incredibly delicate and challenging situation. And thinking about how we can address that, knowing the things we can control and the things that we cannot. I think some of the things that Natalie touched on, those partnerships, we're seeing and we're hearing a lot from our healthcare leadership about how this process has required them to think differently about partnerships, particularly when there are language barriers or other communications issues that need to be addressed as part of helping educate population around eligibility and other factors related to this. So I think anytime there's a significant shift in the system, those partnerships start to happen. And I believe particularly here in Nashville and really across Tennessee, there's a spirit of collaboration. I'll probably talk about this every time I have the microphone, that we don't always agree on everything, but we do try to work together. And so I think you're seeing now, and you will see more community partnerships coming up. In one instance of payers and providers maybe partnering as well, to just make sure that there's really clear communication. The other thing that I think I hear around this in terms of a longer term impact and how does this play out is another area where technology adoption is going to it's going to accelerate. Systems are using analytics and thinking about segmenting out their populations to communicate more clearly, again, getting back to communication in ways that they probably weren't before the pandemic, and then all of the reasons why we continue to adopt technology more quickly. I think the positive is that the technology speed of acceleration and adoption that happened during the pandemic, we're seeing that bear forward in a lot of other challenges that are coming up. And I think redetermination is an example where we're seeing technology start to apply to how we address some of the challenges that come out of this.
So by silver lining, is it like a halo effect of, okay, so we tackled this redetermination issue, the gaps, whatever, with these types of measures. How can we then apply those with other populations, with other efforts, those kinds of, I see what you're saying. We've heard a lot of that in the discussions that I sat in today. A tremendous amount of partnership between mobile clinics and churches. Between the favorite thing that I heard of today was hopscotch, I'm talking about, we used to do it with chalk. It sounds like maybe they're being painted on or sprayed on or something a little more grand now, but as a way of getting overweight youth exercising. And that type of partnership does seem to be a theme, and maybe that's coming out of the pandemic as well. We need to get all of the shared energy as we can out of each of these efforts. So that makes great sense. Workforce is a huge issue. It's been in every panel discussion that I've heard today. It's not just healthcare. You know, unfortunately, we're competing with everybody to some extent. What are you seeing? And Natalie, I'll look to you again. What are you seeing in your organization, in your among your partners? What are you seeing from your perspective that's working? Maybe what isn't working? What's ahead?
So I think when it comes down to workforce, like you said, it's something that we're all dealing with for sure. But I think what everyone is having to focus on is how are we reimagining our workforce? The reality is people have chosen not to work. They have chosen not to come back. And so as we really look through what's next, it really has to happen when we redefine what our new workforce looks like. That comes down to our pipeline, right? When we talk about Nashville being in the center of healthcare, how are we really communicating to that next generation of leaders, right? I met some college students today who talked about, they said, I just wanted to be a part. I wanted to see what could happen, you know, in recent graduates. How are we developing that pipeline? For us at Amerigroup, it was this year where we were actually sponsoring nurse practitioners from ETSU and giving them scholarships so they could go into the rural community into support. So I think it comes down to organizations recognizing where that need is and actually doing the work, whether that is with your pipeline, interns, but ensuring that we're communicating as more senior leaders within the Nashville community to those up and coming folks who want to get into healthcare about what are the things that they can do to really make a difference. So really being clear on our strategies, how we're going to lean in and how we're really making a difference. So I think it's going to be a call truly on leadership and for these organizations to say, so what makes you attainable, right, for a student who wants to come in? I would hate to think that Nashville would be a place that has all these opportunities, but people leave us to go to California, right? Because they think that Silicon Valley and data, not understanding what we have here in Nashville. So I think it is going to be on us to really ensure that we are communicating what we are, how we are, the springboard for future talent, because we want it to remain here. We really want to be that hub for students and younger generations so we can continue that pipeline so we can thrive when we think about the future of Nashville.
Yeah, I'll build on that. This is something I hear about. I sit with CEOs of healthcare companies and educational partners frequently, and I always ask, what's keeping you up at night? And the top three things continue to be workforce, workforce, and workforce. We've seen some alleviation of the pressure in some of the nursing specialties, but it seems like when we solve a little bit over here, something pops up over there. And so I think there are a couple things that are exciting to me on this topic. One is, as I mentioned, our companies are here in Nashville, but they operate in all 50 states, some of them globally. So the solutions that our providers particularly are working on have an opportunity to scale across the country rapidly. So that is exciting to see. So a couple things that I'm seeing. One is partnerships. Again, just some really strategic thinking. Companies like HCA Healthcare are partnering or purchasing, in some cases, investing in nursing programs. So building out their own talent pipeline to ensure that they have the talent that they need moving forward, and that it's, you know, ideally coming into the workforce trained in the way that they need those clinicians to be trained. We see that with community health systems. I think it's Jersey College that they've partnered with in a similar fashion. I think we'll continue to see that hospital-owned or healthcare, the provider side ownership or pipeline management in that really strategic way. The thing that you mentioned, Natalie, that I think is the reimagining piece that we have to focus on, and we are seeing this happen in Tennessee, is there are workers. We knew going into the pandemic. Oh, actually, let me back up. Before we even knew there was going to be a pandemic, the math told us that we were going to have a workforce shortage. We simply were not birthing enough children annually to keep up with demand in the economy. People have forgotten that, but we knew that was coming. Then we had a pandemic, and it created this intense pressure on a problem we already knew we had. So what do you do about that? You have to think about workforce in a different way. I find it really encouraging that we're having conversations around, I call it the hidden in plain sight workforce. So individuals who historically have really been left out of careers in healthcare because they can't stop what they're doing in their day-to-day life to go take on a 2 or 4 or more degree program. And even if they're interested in, let's say, a community college program or a training program, they may not have transit to get from where they are to where the program exists.
Transportation is a huge issue. Again, it's come up several times.
Look, we could have a whole separate issue on the intersection between the workforce challenge and social determinants of health, because I do think many of those factors align. But in the case of reimagining the workforce, what we are seeing is people recognizing that there is a huge amount of talent out there that we're just not servicing correctly. And so we're seeing partnerships. There's a great one between Vanderbilt University Medical Center and Nashville State Community College right now, where they're bringing these programs to the communities where individuals are, and they're rethinking the way a college program works. Things like stackable credentials, which make it possible for someone who can't quit earning an income to go back to school, but they can start acquiring credentials. I call them, it's like a Girl Scout badge. You start to build on, and then you are able to execute a job with some of these skills, these specific credentials, and that helps alleviate some of the pressure on the pipeline. It also helps on the clinician side, where our nurses and our frontline staff can actually operate at the top of their licensure, because we have people doing some of the sort of task level credentialed work down the pipeline. We see this in states like Florida being executed really, really well. I'm starting to see this across Tennessee in a really promising way.
Apryl, do those badges? That's a great analogy. Does that lived experience translate toward? Are they like CEUs? Does that help with qualification or certification?
Yeah, in some cases, there are policy issues that not implicate, but prevent some of this from happening. But in a best case scenario, you have, if you think about a degree 2-year program for a specific specialty, you have the ability to break the skills down that are really being learned in that program and reimagining the cadence and the order in which those are learned by the student. And if you can break those down into modules and stack them into a credential-based learning, you suddenly don't have to have a 6-week or 8-week program. It might be something that this credential takes 2 weeks. So there are programs. There's a great one. It's not Osceola College in Florida. I'll think of it in a moment. But there are some programs in the state of Florida that do this really well. And we're seeing this type of innovative thinking coming into Tennessee, which I think is really exciting. The last thing I'll say in terms of things we're seeing that are transitioning the way we're solving the workforce challenge are some of the innovative companies. So you have companies like Main Street Health, which is headquartered here in Nashville. I believe Inc. magazine just named them the fastest growing company in the world. And they are addressing the rural healthcare workforce challenge by identifying ways to support clinicians in those areas. You have companies like Wellvana, another Nashville-based startup
Monogram.
company. And Monogram is a great one. Yeah, so several companies that are coming out of Nashville, again, accessing these large networks, who are focusing on how can you use technology to schedule, to alleviate some of the administrative burden, things that can take some of the pressure off that pipeline and the workforce, the frontline workers, in ways that, again, I think we're accelerating and we're more accepting of post-pandemic in healthcare. So those types of solutions are addressing workforce as well.
There's an aspect to the workforce discussion or to the work discussion. I'm not sure exactly how it fits in without being alarming, and that is the discussion of AI and the role of artificial intelligence in our industry and in the world, obviously. I heard some mention of it today. It wasn't a huge focus from the discussions that I was in, but there's an implication there for workforce. There's an implication there for clinical care, for financial operations, for everything. it is, if you haven't played around on Chat GPT, I mean, challenge yourself to come up with something it can't do for you. It's really, it's stunning, honestly. What are you all seeing, again, within your own organizations, within your members, within your partners, that excites or terrifies you or keeps you up at night? What rises to the surface when you think about AI in healthcare? And it looks like you have a working mic again.
So I do. So I think the first thing is we have to be realistic about AI, right? And so for some people, they are pessimistic, they are optimistic, and some people are curious. I just so happen to be one of those people who are curious, right? So when it comes to AI, I think about it the impact it can make in healthcare. We can truly be this close to the cure for cancer, right? We can be accelerating how we view behavioral health issues, right? And things that can really make an impact in the people's lives. So when I think about AI, I think about all the good that it can do when it's handled responsibly, correct? And how we look for automation, how that can truly make an impact into the lives of the members that we serve with our partners. So having this information, because data is going to be a big piece of it. For people who don't understand AI or the impact it can have on healthcare, think about all the data that you have access to and having a tool you could really use to solve a problem, right? And so when you think about AI, and when you have discussions, when people come to the table, I implore everyone to really listen as if that person is speaking, if they have the answer that you need. AI could really change the spectrum of healthcare if used responsibly. So when I think about cancer, I think about mental health, I think about all the facets of behavioral health, because we know that has come out more so in the pandemic. So what could we do for those younger children who can't even process, right, what they've been feeling or the trauma they've gone through? Or as we continue with the pipeline, how can we identify that key pipeline of associates and members who we want to have in our workforce sooner and faster? And how can we deliver what they need, what they find as far as success in healthcare? So when I think about it, it really excites me. It's something I'm really curious about. And I do want to see how it can make an impact in Nashville for sure.
You make me think of, I'm old enough to have been at these kinds of conferences for 2 decades. And as recently as 10 years ago, we were talking about all the data that we were collecting because we had to, right? The government said you have to collect this data. And we were, particularly the integrated health plans, they would say, we've got all of this information and we don't know what, we're not doing anything with it. And we've turned the corner on that, right? I mean, we really, maybe we're, still on the surface or less than half the way through, but we're acting on that data. And so it's interesting to think about think of AI the same way. We've got this thing. How do we use it? How do we maximize it? And what additional light can it bring to all of the data that we're collecting and reporting every single day?
I think that's a key piece, ensuring that you're using what you have to deliver on something that you want and really challenging yourself to do that. I know within our organization, we actually have a tool where we can actually give members a report card on how prone they are to certain diseases, mental health issues, right? So using the data we have to really draw a picture for our members so then we can help them on their journey. There are so many people who don't even understand what they've been through or the impact that it can have on their life, whether good or bad. So actually having a healthcare professional that understands that journey, looking at the data, right, to say, hey, I see you have a propensity to do this or to do that. Have you been feeling this way? Oh, actually, I have. I actually didn't know what that was. And now you put a name to it instead of it being, we talked about this at dinner last night, right? Googling it, trying to come up with it yourself, right? So Google MD, we all use it. But when you think about really having that data that can transform the life and wellness of your member, when we talk about the health of humanity, that's a big lift. And so what's your role in that? When you're really trying to improve the health of humanity, you have to use everything you have to deliver on services that they need.
Yeah, and I'll say, just to speak to the point of data, AI is nothing without the data. And given the breadth and depth of Nashville as a healthcare capital with all of the resources we have here, we also sit on a mountain of data in the city. And so our city is inherently going to be at the center of what's happening with AI. We're already seeing many of our big hospital systems announce partnerships I guess in August of this year. I believe both LifePoint and HCA announced partnerships with Google,
Right.
with Google Cloud. And when we had our Nashville Health Care Sessions conference here back in September,
Which is fabulous, by the way.
thank you so much. Please come back next
Mhm.
year. We had the CEO of Palantir, and if you guys remember during COVID, that dashboard that told us county by county data of where the COVID cases were rising, that was all powered by Palantir. So you're seeing those AI, those technology companies coming in and partnering with our healthcare companies already. I think the piece of it, to build on Natalie's point, that's going to be really interesting is how healthcare leadership is at the table when we start to talk about the importance of the guardrails around that responsible use of AI and that technology. And that's something I'm hearing consistently. It's really important that as those guardrails are being developed, that healthcare leaders are at the table for those discussions, because there is so much nuance to what happens in our healthcare system. And we don't always get it right when we try to regulate that. So really thinking about how can we make sure that healthcare is at the table for those discussions is really important.
We are to the last minutes of the day, and so we are standing between these folks and either a beverage or a whole lot of fun outside. By the way, anyone leaving here and going straight to the award ceremony, it's going to be a little chaotic outside, I can promise you. Most people get into healthcare or stay in healthcare because they care about helping people. They care about the end product having a positive impact on patients or on humanity, as you said. As we focus on things like AI and data and the grind of our day jobs, it's easy to lose sight of that. And I'm wondering how you all, how you stay inspired or motivated, and you might have something from your organization, or you might have gotten a fortune cookie, But I'm just curious if you could leave us with something inspirational or motivational. What inspires you these days?
I have a 10-year-old daughter, so we've just actually moved to Nashville in the last year. So I get the benefit of watching. We all think change is so difficult. It's so difficult to make change, especially when you're in the work of healthcare every day. But I have this incredibly resilient 10-year-old daughter who's just moved. She's moved to a new school. She didn't know anybody when she came here. And so seeing her adapt to change, it makes me remember and have a touchstone every day that we're all going to be okay. We're going to figure it out. We can change. The other thing that I am really inspired by is just the caliber of leaders that are in charge in our industry, and the fact that it's just people leading people at the end of the day. And I find from my seat, I get to sit around tables frequently with leaders who maybe they come from competitive organizations, or they might be payers and providers. But when they sit down at a table and they start to unpack the challenges in the system, everybody's interested in making it better. And that inspires me.
I think for me, there's a lot of work to be done. So when I think about it, I just lean in and I do more. So I tell you that, right? Do more. What if you truly had the answer to making a true impact in delivering how we make an impact on healthcare? I often tell the folks that work for me that everyone around the table can have the exact same things, right? They can have grit and passion and fortitude and how we move forward, but there is something different about you. You each have your recipe for success and how you're going to make an impact on the world. So don't shrink in the room full of people, right? Live out loud. I think Nashville is really good. I think it's a good place to live, but we're trying to go from good to great. And so when we think about the impact that we can make, you can be a part of that. So lean in, do the work, don't be afraid, but ultimately do more. We have a lot of work to do, and we will need everyone at the table doing their part to really make a difference.
I heard so many people today, whether they were speakers on a panel or they were asking questions in the audience, they want to do more. You all wanted to share ideas and best practices and cross-pollinate with each other in ways that are really meaningful. I mean, I watch people take notes to take back to their groups and brainstorm and do more and do better. And I want to thank State of Reform for making that possible, for getting these folks together and sharing such great information, and to you all for your willingness to lean in and be vulnerable and share ideas and disagree every once in a while. I don't think there's any disagreement that the day is done. I hope you all have a great evening. Enjoy Nashville. Be patient. Healthcare is our main industry, but today's a big day in Nashville. So be patient with us and have a terrific night. Thanks very much.